the structure according to the age. 1/3 of our population is below 15 years of age. So therefore, we have, and Pakistan is luckily a young nation. So therefore, child psychiatry is important. And the problem is that we are hardly having few qualified child psychiatrists throughout the country. So therefore, the undergraduate doctors, medical students, and general practitioners should, and also the psychiatrist should be able to identify common psychiatric disorders. The common psychiatric disorders that occur among children and adolescents are: number one, intellectual disability, which was previously known as mental retardation, or and the second one is attention deficit hyperkinetic disorder. We will be talking about these disorders. And autistic spectrum disorder, conduct disorder, major depressive disorders, anxiety spectrum disorder, obsessive compulsive disorder, eating disorder, tics disorder, and elimination disorder. So if you look at the epidemiology of the child psychiatry, uh, people between the age of 5 to 17, 6.7% of them had mental disorders. And conduct disorder, ADHD, and ASD were very common among them. Unfortunately, uh, out of the 187 countries, 124 countries didn't have data regarding the childhood disorders. The childhood disorders can be, as I've said, that in DSM-4, the intellectual disabilities were nowadays called as neurodevelopmental disorder, and the learning disorders, which was previously known as the disorder usually first diagnosed in infancy, childhood, and adolescence, are now again divided into the category of neurodevelopmental disorder. So the main difference between ICD, DSM-4 and 5 is that they have categorized all these disorder of intellectual disability, learning disability, motor skill disorders, communication disorder, autistic spectrum disorder in a single category, that is neurodevelopmental disorders. And if you look at this slide, the again, the attention deficit disorder is diagnosed now neurodevelopmental disorder. Then the conduct disorder, the oppositional defiant disorder, which is nowadays called as the disruptive impulsive control and conduct disorder. The feeding and eating disorder was previously known as disorder usually first diagnosed in infancy, are now called as feeding and eating disorders. So this is basically the main difference. And the selective mutism, which is nowadays called as the anxiety disorders. So first, the common condition is intellectual disability, which was previously known as from different name. For example, in previously in the Lunacy Act 1912, it was called as disorder. Idiot was the word which was used, but luckily this was replaced nowadays. And in the meantime, it was known as mental retardation. And nowadays in DSM-5, it is called intellectual disability. The condition is diagnosed when the person has IQ of 70 and below, having decreased social and adaptive skill, according to the which is appropriate for age group, and the onset must be before 18 years of age. The epidemiology is that 2.5% of the population is actually having intellectual disability, and luckily 85% of them are mild cases, and the others can be moderate, severe, profound cases. And males are twice affected as compared to female. As I've already told you, the subclassification can be profound, which is having IQ below 20 and below, and then severe mental retardation or intellectual disability, moderate and mild. The causes can be maybe due to genetic, especially the Fragile X syndrome, and also if there is prenatal causes, like for example, if somebody is having exposure to X-ray, female having a baby, or pregnant women who are exposed to X-ray or different psychotropic medication or other medication, they are having a problem due to leading to intellectual disability. And the condition can be perinatal. So we have to focus on the perinatal. During parturition or delivery, people do not give a maximum, and they do not invest in them. They usually spend a lot of money on the marriages and other ceremonies, but they are reluctant to spend on the parturition or delivery. And here I want to give this message that instead of spending a lot of money on marriages unnecessarily for few hours activity, why not spare some money for our females so that they can have good health during pregnancy as well as during delivery. And then there are postnatal conditions, like for example head injuries, or similarly having meningitis or encephalitis. These can lead to intellectual disability, which was previously known as mental retardation, and in Urdu it should be called as Zehni Pasman. So we in our department at JPMC has started a public awareness program in which we have translated and given some booklets and pamphlets for the awareness of the common people regarding various diseases. Here you can see that mental retardation, which is called still now called as in ICD-10 as mental retardation, and this called के ज़हनी मजूरी या ज़हनी पसमानगी. Here you can see कि इसका तारीफ क्या है, इसके अलामात क्या हैं, वजूहात क्या हैं, तशखीस कैसे होती है, इलाज के तरीके क्या हैं. And this is very important because generally when these kids are, infants are taken to the pediatrician or other general practitioner, they say कि वक्त के साथ ठीक हो जाएगा. I think we have to focus that we have to accelerate their mental growth so that the deficiency and the disparity between chronological age, जो आम जिस्म की age है, and the mental age is reduced. So learning disability is a condition. Here the person will have a problem in impaired in reading or maths or written things. For example, they will consider 6 as a 9 or D as a B. So therefore, these conditions are 4 times more common in boys, and the impairment in maths is 5 times more common in girls, while the reading is 4 times more common in boys, and impairment in written expression is 3 to 10%. And the etiology may be genetic, abnormal developmental problem, perinatal injuries, or neurological, or medication. The treatments we'll discuss in the later part of this talk, but remedial education tailored to the child's specific needs is done. Then coming to the conduct disorder. Conduct disorder is basically include disruptive, impulse control, and conduct disorder. These are the DSM-5 categorization. And the pattern of behavior include violation of basic right of others and social norms and rules, and with at least 3 acts of the following, which can be in the form of aggression against people or animals, destruction of the property, deceitfulness, and serious violation of the rules. The boys are 6 to 16 times more affected, and the girls are having the epidemiology, the boys have 66 up to 16% of boys have conduct disorder, while up to 9% of the girls have conduct disorder. So and antisocial personality has been associated with this condition in adulthood. Increased incidence of comorbid attention deficit hyperconnected disorder and learning disability, and there is increased incidence of mood disorder and substance use and criminal behavior. The etiology again can be genetic or psychosocial factor, and the treatment include multiple treatment approach, like for example structural childhood environment or individual psychotherapy or adjuvant pharmacotherapy, especially when anti-psychotic or lithium or SSRI, which is selective serotonin reuptake inhibitors. The associated condition to conduct disorder are, as I already told you, that attention deficit disorder, but depression is also common, a mood disorder which is common among children and adolescents, then learning disability, especially dyslexia, substance misuse, or less frequently psychosis and autistic spectrum disorder. Now, the predisposing risk factor can be in the form of family factors, which can be marital discord, substance misuse, criminal activity, and abusive and injurious parenting practices. And so these are the factors in the family. Now, the factors in the individual can be in the form of difficult temperament, brain damage, epilepsy, chronic illness, and cognitive deficits. And there are certain factors in the environment which can be in the form of social disadvantage area, homelessness, low socioeconomic status, poverty, and overcrowding and social isolation. So we should consider that the social connectedness is a blessing, and that is a protection for against many diseases. The opposition defiant disorder is a pattern of angry, irritable mood, argumentative or defiant behavior, or vindictiveness lasting for at least 6 months. And here the mood is irritable usually, and they often lose temper and is often touchy and easily annoyed. So the condition can affect up from 16 to 22% of the children above 6 years of age, and usually begin at age 8 years. Onset is before puberty, and the incidence comorbidity in the form of mood disorder like depression, substance use, and attention deficit hyperkinetic disorders are common. So remittance is in 25% of the children and may progress leading to conduct disorder. The treatment is individual psychotherapy, parental skill training, and so on. Then coming to the attention deficit disorder, which is these all categories or topics or conditions are common and they require separate attention. But since this is just introduction, so we will be just touching the common aspects and the common things related to these illnesses. Here you can see that ADHD is characterized by pattern of behavior present in multiple settings that can be at school or home or community. It can result in performance issues in social, education, and working setting. And at least 6 symptoms from either or both the inattentive group of criteria and the hyperactivity and impulsive criteria, which older adolescents and adults must present with 5 symptoms must be present prior to age 12 years. So this condition is usually diagnosed before 12 years of age, and this is common, and 3 to 5% of the school age children, not all children, are having this condition, and it's more common in boys up to 5%, 5 times. The increased incidence again with mood disorder like depression, personality disorder, and so on. And mostly remittance occur in adolescence. 20% of them have symptom at adulthood. So previously, These conditions were diagnosed as bipolar, but nowadays it's called that adulthood attention deficit disorder are also there. The etiology is again genetic, perinatal trauma or toxin exposure, neurochemical factor, neurophysiological factor, and psychosocial factor. And the treatment is pharmacotherapy. Here, the role of pharmacotherapy is important, especially the CNS stimulant, SSRI, and TCA. This is a tricyclic antidepressants are used. Individual psychotherapy and counseling are there, should be done. The ADHD recommendation is methylphenidate is a stimulant, atomoxetine and dexamphetamine are recommended in these conditions. The autistic spectrum disorder is another common category of condition occurring in childhood. The definition according to DSM-5 is number A, persistent deficit in social communication and social interaction. B, can be restricted repetitive pattern of behavior, interest or activity. C, symptom may be present in the early developmental period. And number 4, symptom cause clinically significant impairment in social, occupational, or other important area like schooling and so on. The epidemiology is luckily this condition is less common but very difficult to treat and usually occur before 12 years age, and the epidemiology is 0.02 to 0.05% of the children below 12 years of age. And boys are more commonly affected, usually begin at the age of 3 years, and some associated with tuberous sclerosis, mental retardation, and seizure disorder. 70% of the condition only are having identity disorder. The and intellectual disability is also common among the. The etiology can be multifactorial in the form of perinatal neurological insult, genetic factors, immunological and biochemical factor, and there is no cure, but we can do a lot of them to help manage their symptom, improve their skills, and so in the form of remedial education, behavioral therapy, neuroleptic medication, SSRI, and stimulants. Anuresis or eliminating disorders are urinary incontinence, normally established urinary continence, that means control of the bladder should establish before 4 years, and we never diagnose this condition before the age of 5 years. So involuntary voiding of urine or feces may be due to maybe during the night or day. If night, nocturnal; in the day, diurnal. The involuntary voiding after age 5 is diagnosed, occur at least 2 times a week for at least 3 months. Otherwise, sometime normal kid can have anuresis problem. Individual, the epidemiology is 7% of the 5 years old boys can have this condition, and the etiology may be genetics, small bladder, or ADHD, or psychological stress. The treatment are behavioral modification, pharmacotherapy like antidiuretics and tricyclic antidepressants. Selective mutism is distinguished by the failure to be able to speak in particular situation. When the child is in a social situation such as classroom where he is expected to speak, he is unable to do so. However, he may be able to talk while at home. So they are generally chatty and friendly in home, but generally refuse to talk in front of others, especially in the school. And psychotherapy, supportive family, and behavioral therapy are the common intervention. Now coming to the childhood major depressive disorder, and up to 5% of the children and adolescents in general population suffer from depression at any age time. So that means we have to address this. Male to female ratio is equal, and during adulthood, the females are suffering double as compared to male. So depressive disorder appear at younger age of onset must be treated. And here I want to share my own research that is published in Journal of College Physician and Surgeon of Pakistan, where we saw that presentation of depressive children will not be in the form of generally sadness, but they will come with pain, and the pain may be in the form of headache or abdominal pain and or pain in the legs. Why this happens? Because generally we encourage our children to somatize. Somatize is a phenomenon. Somatization is a phenomena when psychological stress is converted and represented in physical symptom. For example, if a girl say to a mother that my mood is not good, so I may not go to school, she will be scrolled. But when she said I have abdominal pain or I have headache, so she will get sympathy. So therefore, our population generally encourage physical symptoms as a representation of depression among children. The prevention and treatment in child psychiatry or childhood this psychiatric disorder can be primary, secondary, or tertiary. The primary can be stopped before disorder, before it occur, and that will we can achieve with promotion of health, remove the causes, disease prevention. Secondary causes can be identifying disorder at onset, prevent extension, and treatment, appropriate treatment adequately uh, should be started. And tertiary prevention is limit the disability from a established disorder, which is called as rehabilitation, to make the person useful member of the society and earning member of the family. Now, this can be achieved through good enough parenting. Best environment meets needs of the most distressed infant. Worst environment cannot meet needs of the healthy, easygoing infants. So here you can see that this is a tree. On the left side, you can see that the tree is not nurturing. On the right side, it's nurturing, and the causes are from the roots. If you look at the left side bottom, if we provide if the child is abused and there is family history, poverty, discrimination, racism, the child will have in adulthood. You can see at the top of the left side, the person will have fearfulness, nightmare, poor sleep, headache, anger, depression, and so on. On the right side, if you can see, if we provide support, primary care, and also good nutrition, social interaction, the child will have health, well-being, and growth, self-care, hope, and peace, and he will be able to have his resilience and fulfillment. So this is my own article. I have published this, written this editorial in Pakistan Journal of Medical Research. Here we have focused on the bullying and anti-bullying strategy. Generally, the child during childhood and especially school and home environment, we see that bullying is there. This can lead to serious problem. So therefore, nowadays cyberbullying is also common. This can be in the form of email, text messages, and so on. And this require a lot of intervention, and also there should be some punishment for something, and law should be developed for this. Now, how to shape a child behavior? The golden rule is do not disregard child as a whole, disregard a specific behavior. For example, we should not say that this child is good, this child is bad. We can say that you are a good child, but you are late sleeping or indulging in screen time is not recommended. So therefore, the boy or the child should understand what you want to improve. So therefore, you can start with that you are a good child, but because you are not taking care of your sleep at proper time and proper meals, so this behavior should be corrected, so that if he can identify what behavior is not recommended and what is recommended. So here you can see that there could be you can see the child and the authoritative type of parenting, or authoritarian, or indulging, or neglecting. So therefore we have to give children assertive, friendly environment, cooperative, so that they can become intellectually, socially appropriately nurtured. Now, prevention can be in the form of removing poverty and neighborhood unity, promoting neighborhood unity, good housing, employment, child protection from abuse, accident prevention, quality of education, marital and family support. These all can lead to a healthy child. And apart from that, pre parental separation should be avoided. Antenatal care during pregnancy should be adequate. Birth and neonatal period, parturition, and preschool period, middle school and adolescence, all areas need specific care during life cycle changes. The treatment approach in childhood can be parental counseling, psychosocial education, behavioral therapy, cognitive behavioral therapy, family therapy, pharmacotherapy, that means drug therapy, individual psychotherapy, group therapy, occupational therapy, and liaison with other agencies like education, social services, pediatrician, and usually the condition should be treated without hospitalization as outdoor or day hospital, and should be avoided hospitalization. The multiple disciplinary approach is that the informal caregiver, especially the mother and other caregivers, and education department teaching, the teachers should be treated properly trained, and social development of the sector, electronic and print media, social welfare department, and health sector such as psychiatrists, psychologists, neurologists, nutritionists, and a pediatrician, social worker, occupational therapists, nurses, and community leader, NGOs, and religious scholar, all should exert their role and play their role for the development of good health of the children and adolescents, which are really the future of our nation. The medication can include medical therapy, stimulants like methylphenidate, SSRI like fluoxetine and sertraline, and neuroleptic, that's major tranquilizer. Uh, Minor tranquilizer should be tried to avoid it, which are diazepam and lorazepam, mood stabilizer, and hypnotics. The general principle of using of psychotropic for childhood is that start with low dose and increase slowly, and attempt monotherapy instead of combining various drugs because of the liver cytochrome P450 enzyme system. There are generally interaction among various drugs, so therefore monotherapy should be promoted rather than polytherapy. And side effects are minimized by making change slowly. Slowly changes should be done among them. The antipsychotic first line are olanzapine, risperidone, and quetiapine. The second line are sulpiride, haloperidol, and the fourth and third line are clozapine. And here you can see that benzodiazepine, diazepam, alprazolam should be used with for very short period, and antidepressant which are safe comparatively are sertraline, fluoxetine, paroxetine, fluoxamine, and nefazone. Now, this is probably the last slide that you can see that the Convention of the Right of Children, adopted by United Nations General Assembly in 1989, signed by Pakistan in 1990, and ratified by more than 180 nations. Here you can see the childhood rights are protection from harm, and the objective area are health, nutrition, education, and so on. Here you can see that नबी करीम सल्लल्लाहु अलैहि वसल्लम ने बच्चों पर शफकत, रहमत और बड़ों के एहतराम में फरमाया, जिसका तर्जुमा है वो शख्स हम में से नहीं जिसने हमारे छोटों पर रहम नहीं खाया और बड़ों का एहतराम नहीं किया. So therefore we have an obligation, and the किड्स बच्चे अपनी हिफाजत खुद भी कर सकते हैं, वालिदैन को अपना बेहतरीन दोस्त समझें और अपनी परेशानियों के बारे में बताएं, और उस्ताद को भी सरपरस्त और समझें, तो वो अपनी बात अगर खुश उसलूबी से उनसे कर लेते हैं, बात न छुपाएं, तो उम्मीद है तो बहुत सारी मसाइल से हम नंबर और ना हो सकेंगे। विद दिस आई एंड, थैंक यू वेरी मच।